And we'd like to welcome you to the Healthy Flint Research Coordinating Center's excuse me, I'm so excited today, Flint Community Webinar Coronavirus. We are at week 36, and we are just so thankful that you have continued to join us every week to be a part of this webinar. Today, we have an exciting program for you. I'm thankful to be your moderator today. My name is Yvonne Lewis, for those of you that are joining us for the first time, the Director of Outreach for Genesee Health Plan and the co-director of the Healthy Flint Research Coordinating Center. It is my sheer delight to be able to just express our appreciation to all of the partners who joined us every week for 36 weeks now. Since March 20th, we've been here with you, and we are just so excited that today you're going to again hear from some of our extraordinary partners who have chosen to be with us each week. We've had some technical difficulties. I just want to acknowledge that. Our internet went out, and so we had to make some quick shifts. And so we are thankful to the team that works behind the scenes who don't often get recognition, but the team is an extraordinary team of technicians that keep us going. And so today, all of our partners, we appreciate you, and we look forward to this great information that we're going to share with you. For those of you that are coming from the HFRCC Research Symposium, we appreciate you for flipping over and remind you that we'll be going back at the end of this hour for the additional the inaugural research seminar that will be hosted by the Healthy Flint Research Coordinating Center. We'll tell you more about that in a moment. Today we're going to start off with some very important information from the state of Michigan. And most of you have heard that we now are moving in. We talked about, the governor told us early on that we were in this position where we may have to weave in and out of some protective measures that were being put in place. So there are two very important announcements. I know Gary Jones is going to share with us, who's the community affairs representative for Flint out of the governor's office. Gary, we're delighted that you joined us today. So please give us the insights that you know are so important to our community.
All right, thank you, Yvonne. I've got a couple of announcements here, but won't take too long today. So let me start off just by giving an update in terms of total confirmed cases for COVID-19 statewide are now 285,398. Total COVID-19 related deaths are 8,324, and total recovered COVID-19 cases as of November 13th are 138,862. And just as a reminder to everyone, recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. So actually recently, the governor and Democratic leaders sent a letter to President Trump and Congress urging them to pass a bipartisan COVID-19 relief bill. The governor, Senate Democratic leader Jim Ananich, and House Democratic leader Christine Gregg sent a letter to President Trump, Mitch McConnell, Nancy Pelosi, Chuck Schumer, and Kevin McCarthy, urging them to take swift action and pass a COVID relief bill that provides support to help combat COVID-19, mitigate its economic fallout, provide support for our schools, and protect frontline workers, restaurants, and small businesses. Also recently, in similar fashion, there were a bipartisan effort amongst governors from Michigan, Illinois, Indiana, Kentucky, Minnesota, Ohio, and Wisconsin, who recently posted a social media video just to encourage everyone across the region to remain safe heading into the holidays. And Yvonne, to your point, recently NDHHS issued a three-week epidemic order to save lives, protect frontline heroes during the fall of the COVID-19 surge. So there were a new order that limits indoor and outdoor gatherings where COVID-19 is most likely to spread person to person. So the Michigan Department of Health and Human Services issued this new emergency order this past Sunday, and it took effect Wednesday, that enacted a 3-week pause targeting indoor social gatherings and other group activities in an effort to curb the rapidly rising COVID-19 infection rates that we have been seeing throughout the state of Michigan. And also, just as a final note, I wasn't on last week, but I did want to mention this because it's special to our community here in the city of Flint and in Genesee County. But the governor recently announced the appointment of the Black Leadership Advisory Council. So these were appointments that were made to the Black Leadership Advisory Council, which brings together a diverse group of Black Michiganders to serve in an advisory capacity to the governor and develop, review, and recommend policies and actions designed to prevent and eradicate discrimination and racial inequity in Michigan. We have two Flintstones that are actually a part of this council. So Christopher Bertley was appointed to represent Black leadership in law, and as well as a member between the ages of 18 to 35. And Teresa Roach was appointed to represent Black leadership in health and wellness. And just as a note, this is very important here, there were nearly 700 people that applied for 16 spots on this council. So for Flint to occupy two of those positions is just phenomenal. So if you know either Chris or Teresa, make sure to congratulate them, as they undergo that work. And as always, michigan.gov/coronavirus is still the best website to keep updated with everything.
Thank you so much, Gary. We really appreciate that. Knowing that you can bring us information directly from Lansing is very, very important to our community. So we appreciate your voice. And the reason we want to start off with you today is because of those two essential things that you talked about, the equity piece as far as the statewide leadership for African Americans at Advisory Council to the governor, but also with this transition and moving back to the 3-week pause. Dr. Deborah Verholden gave us information last week about the fact that here in Flint, Genesee County, we were able to reduce the disparity. And we wanted to have her come back this weekend to give us some more insights before we move into hearing from our community members today. So Dr. Deborah, would you please share with us the insights that you're gaining from looking at the data that's been made available for our community?
Yes, and I want to acknowledge y'all really got to appreciate, we had a whole lot of champions in the background that make all this happen and make it go forward. And I just want to give a shout out to Suzanne Koopel from the Health Department, who just received our Community Champion Award at our HFRCC Research Symposium. Oftentimes it's the leader of the actual organization, and our health officer, John McKellar, just retired, but Suzanne Koopel's been at the Health Department, I believe, for 6 years. She can correct me when she speaks. And she worked really hard to get us a data user agreement so that we could be helpful to our local health department, who is swimming over their eyeballs and doing everything they can to turn the tides on COVID. So thank you. And I also want to acknowledge Dr. Rick Sadler, who has he's our local native owned homegrown geographer, who has built a massive data and methods team in the background with an almost exclusive purpose of being of service to help turn the tides on not just COVID, but many of the health problems that plague us in Flint, Genesee County, and across the nation. So when I tell you hot off the press, I just got this from Dr. Sadler. We've all heard that the COVID rates are increasing. COVID rates are increasing, not just in Genesee County, not just in Flint, but also in Genesee County. The rates of infection have more than tripled since the start of the month. What does that mean? In the past 3 weeks, the rates have increased from 157 cases per 100,000 to 497 cases per 100,000. Now remember, we're a city of just under 100,000 people. So we're talking about nearly 500 active cases in our community right now. I cannot underscore this enough. I hope every other speaker that comes behind me underscores it as well. We must practice social and personal responsibility. I think what has allowed Flint and Genesee County to do as well as we have in this pandemic is the fact that we've got good leadership. We implemented citywide curfew before we even had one death in the city of Flint. Those protocols and the things that we've been able to do at the state and at the county and at the city level get counterbalanced when people don't do their part to keep themselves and others safe. The rates are increasing all across the country, and we are no exception. People, please honor the protocols. All right, your disparities update. How are we doing on COVID disparities? You guys, I'm gonna just keep updating this. And again, I wanna acknowledge Dr. Sadler, Rick Sadler and his team, who provide this information for us weekly and will be providing this to our health department. And now we have one of our homegrown leaders, Mary Catherine Crawford, who is a MPH trained epidemiologist, public health person, who's going to be working now every week on providing a policy brief for policymakers in the city of Flint. That's going to be forthcoming next week. So where are we on disparities? African Americans are 60.4% of Flint residents. Back in March, when the pandemic started, we started to sort of peak out in April, May. African Americans were 85% of cases and 91% of deaths. I reported out on this last month. Last week in September, we were 38% of cases and 50% of the deaths. That is a substantial reduction from 85 and 91% to 38 and 50%. What that means is we eliminated the disparity. What you would expect to see is if we're 60% of the population, we should roughly be about 60% of the cases and 60% of the deaths. We're continuing to make strides on narrowing the disparities and dealing with those systematic and structural issues that place African Americans and other people of color in harm's way. In October, you can see it's shrinking even further. African Americans in October were 12.7% of cases and 20% of deaths. So the racial disparities in COVID have been eliminated in Flint, despite the recent increases in cases. But we have to ongoingly monitor those trends to ensure that all of the massive amount of efforts between the health department, the hospitals, the Greater Flint Health Coalition, Hamilton Community Network, all of our social service providers, Genesee Health Systems, all those partners that are on that slide that you first showed, Yvonne, we have to ongoingly monitor these trends and ensure that these efforts are not done. To that end, I'm going to encourage people to practice safety for Thanksgiving. Safety for Thanksgiving is a single household Thanksgiving celebration. This is not the time for us to see a reemergence of disparities because African American families have decided that they're going to bring 4 or 5 households together during this time. I'm going to skip through some more of the sort of graphic displays of the stats. What I just want to say is the trends in the narrow disparities are standing up, and Flint relative to Genesee County, you can see early in the pandemic, Flint outpaced Genesee County. Flint is now, dollars for donuts. Our population relative to the number of cases, we're actually below Genesee County. We have a tremendous opportunity here to keep our community safe. We've got to not just rely on what's coming out of City Hall and the health department and these other places. We all have to practice personal responsibility. We've got a few hot spots in the northeast corner of Flint and in Flint Township. So literally, if you have family members and relatives in those areas, please be a source of encouragement and support for them. Let's all do our part to keep flattening the curve. Thank you, Yvonne.
Thank you, Dr. Deborah. And I think, did we have another award winner from the symposium as well today?
I believe we did have another champion.
A champion. I noted that, you mentioned Suzanne, and she's been with us 36 weeks, but I think this other individual has been with us about 35 weeks, but a longtime champion in the community. And he is, I will call him our Chief Health Advisor, Dr. Lawrence Reynolds. Congratulations to you too for being one of the award recipients from the Healthy Flint Research Coordinating Center as a community champion. And Doctor, based upon what you heard from Gary Jones and what you just heard from Dr. Deborah Verholden, what say ye? Dr. Reynolds. Okay. He may be having one of those technical glitches as well. Billy Mitchell. I want to just acknowledge Billy Mitchell too. Billy Mitchell was also awarded one of the young scholars and up and coming key people in our community. We appreciate you, Billy. Ever since I've been working with you for over a year, almost 3 years now. And you've been just a stellar person in our community, speaking on behalf of the community. So while we're waiting for Dr. Reynolds to get connected with us again, please, Billy, tell us what's happening at the city.
Yes, I want to give everyone an update. All of the forms that were submitted to the city of Flint, the opt-in forms for pipe replacement, they were all turned in by the deadline of November 19th. Of course, I was going every week up until the 19th, but All of them are out of our office, and they are with Roe. So if you have received a letter on your door from Lane, please follow up with Lane. You have to call them back at 810-743-6702 to have your water pipelines inspected, okay? And if you have any questions about your opt-in form, you can always contact Roe. Their number is on the screen, and that number is 810-410-1133. And if you want to contact me for any questions, if you just need any further guidance, you can reach me at 810-237-2044. We are still doing water restoration as well. If your water has been turned off, you don't have to be caught up on your bill. You don't have to be caught up on your property taxes because it is a pandemic. You can get your water restored for free. And that number for water restoration is 810-410-2020. Now, I do have a couple of more updates also, since you know that Flint City Hall is currently closed to the public. We are still giving out filters, masks, and water test kits at our new walk-up window. That's a new addition we made because of this pandemic and that we're not open. We still want residents to be able to come down to City Hall and make either their water bill payments or their property tax payments. And then at that window, which is open from 9 a.m. to 3:55 p.m. Monday through Friday, you can also get your water filters, your mask, and your water test kits. It's the same protocol as before when we were shut down. You just call the 810-410-2020 number, and we'll pack your bag and we'll take it right over to the customer service department, and you can come get your filter if you need to. Last but not least, if anyone is interested in having public health navigators participate in your meetings or your events, you can email me, Billy Mitchell, at bmitchell@cityofflint.com.
Thank you, Billy. And I'm so glad you answered that question about the filters, because someone just asked me that question and I said, I know you would be able to give us the answer. So I appreciate that. The filters still are available. You have a walk-up counter, and we appreciate the city being able to be flexible and address the changing tides that we're having and still be able to get residents what they need. One other quick thing, Billy, I just got a letter the other day about meters being replaced. And I don't know if that's something we can really deal with today, but they are replacing water meters as well. And so if you get that letter, they want you to pay attention to it. Do you have any quick updates on that, Billy?
I don't have any quick updates, but if you did receive a letter, go ahead and reply to it. I'm not sure when the letter was received. It may have been received before we were shut down. So I'm not sure with DPW, our Department of Public Works, if they're going into homes because of COVID. So I can get an answer for that, and I can reply if it's in the comments in the Q&A.
Thank you so much. We appreciate that. Now, as we're looking at moving forward, we know that we mentioned that. Congratulations again, Billy. Congratulations on your award today. We talked a little bit about Suzanne Kupel and the Genesee County Health Department, because we know they're really critical to the work that's happening in our community. And there's been a lot of work done on the COVID testing and contact tracing. And so Suzanne is here today with some updates for us. Suzanne.
Hi, everyone. And Dr. Verholden asked about how long I've been at the health department. I joined the staff in February of 2009. So thank you. And again, thanks to everyone for the award today. It's very much appreciated. As you can imagine, the last 6 years have been challenging, and we are in the middle of a pandemic. And as everyone is very well aware, we're in a pause because we're seeing significant increases in the number of cases that we have in Genesee County. So as of yesterday, we posted 10,261 positive COVID-19 test results with 358 deaths. Again, this is not reflective of all the likely cases of COVID-19 in our community because we had limited testing at the beginning of the pandemic. Our positivity rate is currently 14.9. So it is critically important that everyone take good care, use all those preventive measures, wear a mask, social distance, wash your hands, use the hand sanitizers, wash frequently, touch surfaces. All of those things are really important. Recognizing how important it is also to get tested for COVID-19. And as Dr. Reynolds likes to remind everybody, it's not a one and done, that you probably want to get tested more frequently over the course of the pandemic. And we have lots of locations that are available to us in our community in order to get tested. So we do have our 3 community sites. We also have the Rite Aid that is in Swartz Creek, the Rite Aid in the city of Flint on Clio Road. We have the Walgreens in the city of Flint. And we also have our partners at Hamilton Community Health Network. They are available at their North Point Center, and they are also available at their fire station at the corner of Bristol and South Saginaw. So want to make sure everybody is very much aware of those things and that you take advantage of them. Sharonda Grigsby will share a little more information about what updates are being done at those 3 community testing sites, because we know that all of the sites, that includes our community sites and urgent cares and doctor's offices, are seeing an increase in the number of people who want to be tested for COVID-19. So we strongly encourage all of you to please make an appointment and be prepared if you have a bit of a wait when you get there, but you will be cared for and you will receive service. This is the time frame also to remind everybody about getting a flu shot. It's critically important that you do that. We have 2 respiratory illnesses at the same time, flu and COVID-19. And we also strongly encourage everyone to talk with your family and friends and have a plan, not only for the Thanksgiving holiday, but for other holidays that will follow, about what you're going to do and how you will celebrate safely. So again, we're making sure that everyone is taking care of their physical and mental health. And we can talk a little bit more about contact tracing, quarantine, and isolation.
Thank you so much, Suzanne, for giving us that update. And as you mentioned, we're so thankful that people are now going to these sites and utilizing them. So that means it's going to be a little bit longer. So Sharonda Grigsby from the Michigan Department of Health and Human Services in Lansing was to be here with us today, but I don't see that she has joined us yet. But we really want to just remind you again, as Suzanne said, that these sites are available for us to use in the community.
So Yvonne, can I just share that they're going to expand the footprint in the building at Macedonia, making it a little easier for social distancing with the volume of people that are being seen, and trying to eliminate a few stairs that could be a barrier for someone who has mobility issues. There is additional signage being added, but we strongly encourage you that if you can make an appointment, please do. And if you do come without an appointment, just be prepared for a little wait, but you will be cared for.
Right. So I just want to remind you again that there are some holiday hours. And Suzanne, I really appreciate that, because we've had a number of questions in the last couple of weeks about the community sites, and that sometimes the test results are not coming back as quickly, but we know that it's also a factor of having more tests being done. But we do want you to be patient. We want you also to share your concerns. When you share your concerns, I will tell you that Sharonda, as well as Suzanne and others, have been very diligent about talking to the state leadership about what these concerns are, to even encourage those persons who are responsible to come to Flint and actually take a look for themselves. So I want to encourage you, as I've said often, our voices do count. You heard that on many occasions, especially if you were in the seminar earlier, the symposium earlier, you heard the importance of community voice. Your voice counts, but we also want to be able to share our voices in a way that we can be heard. So please continue to let us know what the challenges are. The dates for the holidays, and I think is on our next slide. The dates for the holidays, they will be closed the Thanksgiving Day and the day following Thanksgiving. And then we can look forward to some Christmas closings, Christmas Day, Christmas Eve and Christmas Day, as well as the day following Christmas. and New Year's Eve, New Year's Day. And then January, we'll be talking more, but we'll know that King Day will also be a date closed for these sites. While we are, I saw Dr. Reynolds was able to join us. So again, thank you, Suzanne, for that update. And Dr. Reynolds, I think if you can unmute yourself now and come on, I know you have some great things that you want to share with us as your advisory. And then we've got a surprise for folks for next week. So Dr. Reynolds.
All right, can you hear me?
Yes, sir, we can hear you now.
Can you hear me?
Yes.
All right. I want to thank the HFRCC, but I'd also like to thank our Flint network, because we keep each other accountable and make sure we get the information out. And what I'd like to say, number one, is if you started quarantine last Friday, you have until next Friday before you can come out of quarantine if you have no symptoms. Okay?
Dr. Reynolds, would you say that again? You mean 14 days is what you're saying in quarantine?
14 days, you got it. So if you are in quarantine that started last Friday or today, you need to stay in quarantine and avoid unnecessary contact. Did you hear me?
Yes, sir,
and
I
if
did.
you are in isolation and you started, if you started in isolation last Friday, this is the beginning of the end of isolation if you have had no symptoms in the last 7 days, like fever. If you've had a fever in the last 3 days, you need to stay home. If you feel sick, you need to get tested, and then you need to stay home in quarantine. If you have had contact with someone who is positive, you need to stay in quarantine, especially if it's been less than 14 days. So in other words, if it started last Friday or after last Friday, you need to stay in quarantine. And this is how we protect ourselves. Now, the holidays are coming up, and I'm going to move fast. Refill your medications if you're on any medication. I've said this before. Know who your doctor is, what hospital he or she may use, so you know what to do if you have a problem. How do you know you have a problem? You have a thermometer to take your temperature. If you are at home in isolation, you need to have your supply of Tylenol or ibuprofen on hand. You need to have your mask, your gloves. You need to have your house set up as best you can to reduce contact. And I've even gone to the extreme of recommending that people get a big trash bag, cut an opening for your head, an opening for your arm, and cut up the back so you don't have to slide it over your head, because, you know, some folks may get tangled up. But this is to protect your household and yourself. And remember, if you're sick, you don't need to be inviting people from outside your household into your home. If you're in quarantine, you don't need to be inviting people from outside your household into your home. And, you know, I know it's a rough season to do these things, but we want to be around for the next holiday or next year. So we are protecting our loved ones, we're protecting our community. So please, think about it. Restrict your celebration to 1 or 2 households, and that other households, folks need to know their status. So who should get tested? If you feel sick, get tested. If you leave your house for any purpose, get tested. If you have never been tested before, get tested. If you're alive, get tested. That will tell you what you need to do for at least the next 7 days. It may tell your family what to do for at least the next 14 days. But remember, as my colleague Suzanne Kupel has said, you get tested once, you may need to get tested 3 to 4 to 7 days later, because You may have been tested too soon, but testing is available. And please plan ahead, refill your medicines, know where you need to go if you have a problem, which hospital, and let's get through this holiday safe. Thank you.
Well, thank you, Dr. Reynolds. You gave us a whole lot to think about in that list. And I will say, want to thank our participants because someone asked for that list. So next Friday, and I know next Friday is the day after Thanksgiving. So I have a favor to ask of you that are listening. For those of you that are interested and will be available and wanting to join us next week, just put a little note in the chat. You can put us, you can put that reaction up there and let us know that you're interested because we're going to actually put this list and make it available. So it is on our webinar and you can look it up. You can go back and review it and maybe even make copies of it. For those of you that are interested in any of these presentations that are part of our webinar today, you can always go back and look for it on YouTube. We do ask you to like us on YouTube and follow us so that you'll be able to get all of the information. So again, thank you, Dr. Reynolds, for this insight. And you mentioned the holidays. Holidays are coming up and many of us want to get out and be amongst our families and friends, and that is a challenge. So put those questions in the Q&A for us as we are hearing our next speaker. We're going to talk about now mental health for the holidays. Last week, Katie Baxter was all prepared. We had so much information last week. She just gave us a little snippet of information about mental health for the holidays. Today, she will have a full time to really give us some insights. It is challenging, and I know many people have talked about, we heard earlier that some have lost loved ones during this pandemic, and so we may be sitting at tables alone, remembering someone who would have sat at that table with us. We need a little help to get through here. So Katie, would you please give us some tips as the representative from Genesee Health System? How do we get through this? What's the tips for healthy mental health during the holidays?
Certainly, and thank you, Yvonne, for having Genesee Health System here again today. It's always a pleasure to be here with your distinguished panelists and learn about all the good work that's being done in the community and hear these updates. It's so important. I'm here today to talk about mental health and to remind all of us how important not only is our physical health, but our mental health as well. That's all part of our health. So I want to talk to you a little bit today about what are some things we can do during this holiday season to take care of ourselves and to take care of others. So I want to say, first of all, that keep in mind the holidays, this is usually a time of happiness and excitement and a lot of joy, but the holidays is not that way always for everyone. So pay attention. Most of us have family members or neighbors or friends who have mental health or substance use disorders, and the holidays tends to be a difficult time for individuals who are struggling with behavioral health issues. So it's important to reach out to those folks. Now, I don't mean we need to physically, we'll talk a little bit about that, about other ideas, but there are ways to engage with people, as we've talked about so many ways, virtually, and just letters and even the phone sometimes, just chatting with people, because it's really important that we all feel supported. The first part I want to talk about is preparation. This is so important because if we prepare for things, we're in a better situation for things to go well. So keep in mind that the holidays are going to be different this year. It's not going to look like last year or other years, and that's okay. We want to keep in mind that it doesn't have to be the same all the time. We can still create positive memories and have fun and do a lot of the things we like to do, but we can do that safely. So just keep that in mind, that just because it's different than other years, it doesn't have to be a negative thing. So find creative ways to make some special ways with the holiday this year. Keep in mind that all of us have certain triggers, and triggers are things that may get us not feeling regulated or well, or may emotionally trigger us. And it could be people. There are sometimes people in our life that do not contribute positively to our mental health. And sometimes there's a negative relationship or something there. It could also be situations or things that happen. Maybe it's memories. Sometimes we have memories of the holiday, whether it's losses of people we love or things that have happened during the holiday season. So keep in mind that we all have some triggers and be aware of that. And so if there are things you can do to counteract those triggers, it's wise to do. And it might mean choosing not to interact with certain people who might actually kind of bring us down rather than building us up. And I think that's really important to keep in mind. As we're being patient with others, remember to be patient with ourselves and give permission for ourselves to say things don't have to be perfect. And sometimes we put a lot of expectations on ourselves that we have to have, you know, this certain meal and these certain decorations and this certain kind of gathering or all these things. And remember that we are in the middle of a pandemic and things are going to be different, and it's okay. So give yourself permission to do things differently and celebrate a little differently. I want to encourage people to remember to set aside differences. We are all different, and that's what makes the world a beautiful place. We have a lot of diversity in our opinions and the way we look at the world. And so to remember that we are different and we're not always going to agree on things, and that's okay. Sometimes we expect that our loved ones or friends and family have to have the same opinions that we do, but that isn't always the case. So we practice a little acceptance that, okay, well, I know so-and-so, this relative or friend, and they don't look at things the way I do, but that's okay. We can see things differently and still remember that we care about people. So it's okay to agree to disagree. I think that's important to remember. Also, don't hesitate to set limits when we need to. It's okay to take care of ourselves, to protect our family. And we may have invitations and we may be pressured that we need to go here or there or do those certain things. And we want to feel safe and we want to make sure that we can create memories and further holidays. So be wise and set limits. It's okay to do that. You know, sometimes we feel, oh, I feel so guilty if I don't do this and I don't come to that. Keep in mind that protecting ourselves and others is very important to do. So we do want to follow the orders from the state. And we had all of our panelists, Dr. Deborah Furholden, and the others talk about, keep in mind, we do have orders that we want to follow so we can still have fun and be safe and follow those orders. I would encourage us to reach out to people who bring us up and build us up. All of us have people in our lives that are like that. And we can be that way for others, and we can reach out to those who do the same for us, because that can help us feel supported and kind of get back on track. Some of us, we all have bad days, and it's good to reach out and get lifted up by somebody who cares about us. The other thing is to keep in mind how important self-care is. If we are already run down and not taking care of ourselves and are stressed out and are not caring for ourselves in healthy ways, we are really at risk for not only illnesses, but also mental health challenges and all kinds of problems. So it's very important to remember to just take care of ourselves. The holidays, a lot of times, is times of lots of sweets and treats and all kinds of good things. And I think that's okay, because I think moderation is important and that we enjoy those things. But just to keep in mind that it's good to have moderation so that we can feel good about ourselves and what we're doing. And be sure to get adequate sleep. And that's so important. If we're not sleeping well, that affects how we feel. It's very important. There's also ways to get exercise that are, not necessarily doing regular calisthenics or going to the gym, but if you have to go to the store to, get groceries or what have you, park on the way back and walk up to the store, things like that. There's little ways that we can get exercise. If you're working at your computer or you're helping your kids with school on their computers, in between your breaks, take time to do some exercise or get outside and take a walk and enjoy enjoy a little sunshine. Sunshine's good for us too. Keep in mind to be careful about our use of tobacco and other substances. Many times we want to celebrate during the holidays, and that's okay too. But avoid excessive use of that, because that can end in family disagreements or issues or other problems. So be aware of that. And if you are having concerns about yourself or a family member related to substances, please reach out for help, and I'll give you that number at the end. I mentioned about getting outside and getting some sunshine, and some days are sunnier than others, I know that, but just even daylight is important, and our days are shorter this time of year, and some people are really affected by the shorter days and the lack of sunshine. There's something called SAD, seasonal affective disorder, that can impact us negatively. So sun is important, and daylight. So if you can open up your shades when you're inside to get a little bit of that natural light, if the weather is reasonable, take a little bit of time. It doesn't have to be all day, but even a short walk or something, a lot of times that can really lift our spirits and help us feel better. So I encourage you to do that. Very important for us to practice meditation or prayer. These practices can really help us to stabilize, to feel safe, and kind of regulated. Sometimes we're rushing and we're trying to do things, we're not thinking clearly, and sometimes we'll make decisions or say things that we'll regret later. So it's important to slow down a little bit, practice mindfulness, meditation, or prayer. Most people who practice these things, and there's a lot of research on this, that it really is very beneficial to them. So I encourage you to do that. Also, we do want to limit our time on social media or news outlets. There's a lot of negative things that we read and see, and too much of that can be very detrimental. Sometimes people, you may have heard the word doom scrolling, going through and seeing all these things, and then you feel worse about the world and what's going on. So it's okay to stay informed, but we don't need to have that constantly coming at us, and it's probably not good for us. I mentioned again, this is related to the other one, but mindfulness is being present in the moment, and to kind of accept the current moment and to be mindful of what's going on and be present, not focused on fearful about the future or about the past, but acknowledging the present moment. And we find it can really help regulate our breathing and put us in a better state of mind mentally. We can do things like listening to music that we like, that's uplifting and that is fun, or music that we enjoy. Reading books. This is also a good time to finish those projects that we've wanted to work on and we simply haven't had the time. So we all have to look at positive ways when we're dealing with the pandemic. What are positive ways that we can come out of this, and remember that it will not last forever, although it seems like it. I realize that it will not last forever, and it's important to take the time to make some positive changes in our life. And the next slide. Attitude is everything. This is so important because the way we look at the world really affects the way we feel about ourselves and others. So there's a lot of research on people who practice things such as, what are they grateful for, and thinking about that and thinking about positive things in their life and the benefit of that. And that has been proven to really help people feel better and look at the world in a positive way. So I think that's really important. I noted here some things about fun things that we can do. We can still do these at home, decorating, baking, or creating projects. I notice a lot of people are setting up Christmas things earlier than they normally would, and that's okay. And I think that's fun. Sometimes we need to lift me up, and those kinds of things can really bring us up, and we can have fun with that. Laugh and humor is really, really important. And they talk about smiling, that there's even research that when you make yourself smile and you say, I'm just going to really smile more often, it actually creates chemicals in your brain and you feel a little better. So it's so important to find the good in the world and the beauty in the world, and to celebrate those things. I think it's important for us. I mentioned gratitude. Oops, go back this one a little bit more. Gratitude, how important that is. And you've heard people say it's hard to be hateful when you're feeling grateful. So gratitude's a beautiful thing. All of us have some things to be grateful for. And it feels good to think about those things. Keep in mind to think about others. And you've heard in giving is when we really receive. There's a lot to that when we do other things for others. And again, we don't have to go out and expose ourselves or be in other households. I'm not suggesting that, but there are still ways to do random acts of kindness for other people that are safe and help lift them up too. And you know what, when we do for others, we really feel good ourselves. So the last one I just say is choose your attitude. Keep in mind that when we have a positive, playful, kind attitude, and we treat others with the love and respect that we want, good things happen for us. So keep that in mind. That's very important. Lastly, I want to remind us that sometimes we do need mental health help. And so if we're in the need for any kind of mental health help, please reach out and get it. I hear sometimes family members say, I'm worried about this family member or this person or this neighbor. Encourage people to get help. There are a lot of resources out there, and the best thing to start with is our crisis number. And I think we have that on the next screen up here. Our crisis number is 810-257-3740. And that is our 24-hour crisis hotline number. So keep in mind that we are available for help, and we serve people, individuals who have mental health issues from every spectrum, every age, from young children, families, to elderly folks. And we serve people with more mild to moderate mental health issues, as well as individuals with very serious mental health challenges. So the first step is to call us and find out how we can help you. We are here, and do not be afraid to ask for help. If you had a medical issue, you would reach out to your doctor. So if you have a mental health issue, it's okay. Reach out to us, and we're here to help. And thank you so much for listening.
Thank you so much, Katie. And I appreciate you giving that number out, because there was a question in the queue about a hotline number, and people can use this number at any time. I guess one of the questions is, do they have to have insurance in order to be able to get assistance from you?
No, you do not have to have insurance. We have a variety of programs, and depending on what your needs are and it doesn't matter your insurance, because not all programs require insurance. We have a new behavioral health urgent care program that allows you to talk with a counselor, and that is 24/7, and it does not require insurance. It requires that you have some access to some kind of virtual platform. And we can talk to you when you call. So please do not let not having insurance or whatever kind of insurance you have keep you from calling us.
Thank you, Katie. And one other thing, during this holiday season, I know, and during this time when parents have had to be closer to their children, they may have noticed some things. And I just want you to remind us about the Neurodevelopment Center that allows parents to have their children assessed if they really are concerned about some of their child's mental health needs.
Yes, we do have the Neurodevelopmental Center of Excellence, and that is there we provide autism testing, as well as testing, neuropsychological testing for children, and mostly children who have been affected by the Flint water. So feel free to call. I think the best number is to call our main number, and we can get you connected with that department if you have those needs. So yes, we have that service available as well.
Thank you, Katie. And you've agreed to come back at future times because we're getting into Thanksgiving, but there'll be more things even as we get to the Christmas and New Year's holidays that I'm sure you'll be able to share with us, and maybe even give us a couple of examples of things that people can do to help us maintain our mental health. So Katie, thank you again for being with us. This has been a really full day. I know that many of you have participated in both the symposium and the webinar. I want to remind you that immediately following our time together today, we're going to move into the Healthy Flint Research Seminar. Now, the symposium provided for us an opportunity to get some real insights, and we looked really closely at equity. There's conversations about what's happening in terms of the vaccines that are being talked about as it relates to COVID, and then the equity. There are vaccine trials going on. There's so much information that's being made available. We want you to stay connected with us as we provide additional information going on forward. If you were not a part of the Healthy Flint Research Coordinating Center Symposium, you can still join us in the next hour for the research seminar. This seminar is designed to make sure that you can get insights on local research that's being done in partnership with communities. So our academic partners who are research focused are partnering up with community members in order to ensure that this research is going to be most beneficial to us here in Flint, Genesee County, and how we can share this and how it has been shared with others across the nation. So you can see the agenda here. One of our partners, who is also a co-director for of the Research Coordinating Center, Carmen Stokes, will be moderating this event immediately following. We'll hear about the Flint water crisis, a truth study and needs assessment, and a plan for action. We'll also hear about a novel approach to participant engagement through comic books, and then ultimately how the community-built recruitment for strategies to Flint-based stroke preparedness intervention. Remember, we've been told that even in the midst of this pandemic, if you have underlying health conditions or if you've had other problems, you still need to seek care. And this stroke prevention project will give us some insights on that. So look toward joining us again on this symposium. On the research seminar. We want to remind you, as we do every week, that there are CEUs available for our community health workers. We want to thank our community health workers for even reaching out and asking about this possibility, because it prompted our team behind the scenes to make sure that these are available to you. And we're working through MISHWA, which many of you are familiar with. So continue to be a part of these webinars so that you can get those CEUs. And on the horizon, we're looking to get CEUs for social workers and potentially nursing. So please continue to give us those questions at the end of the webinar, areas of interest for you, so that we can be sure we're following through. Let me remind you again, if you're interested in continuing and want more information, please like our YouTube, like us on Facebook, Healthy Flint Research Coordinating Center, or subscribe to our YouTube channel at Healthy Flint. And then you can always email us. And we are thankful that some of you have been emailing us at info@healthyflint.org. Or please, at any time, give us a call at 810-835-2130. And I just got a quick thought. Dr. Reynolds, I wanted to just ask you one more time, because someone asked me this and I don't want to forget. And Suzanne Kupel, you might be able to answer this. And I only have a couple minutes, but this is really important. An individual sent me a note that says, what is the quarantine process if you are caring for a loved one who has tested positive? I just want to make sure we get that question answered for them before we move into our last slide today. If a person is caring for a loved one, they're the caretaker for someone who has tested positive, what should their quarantine process be? What should they be doing?
This is Suzanne. So if you are quarantining, there's two things. Remember, quarantine and isolation. If you're quarantining, you are taking your temperature twice a day and you're monitoring for signs and symptoms of COVID-19. So recognize that could be a cough, it could be the loss of taste and smell, it could be a fever. There are many different signs and symptoms for COVID-19. If you are, again, isolating and you have symptoms of COVID-19, you're going to want to make sure that you're looking for any exacerbation, increase of those symptoms, extremely elevated temperature. You want to seek help immediately if there's difficulty in breathing or any of those other more pronounced symptoms of COVID-19. Remember,
Suzanne, let me make sure I've got this question. The person who is caring for the individual wants to know, should they be quarantining until they get a negative test?
To someone who's tested positive for COVID-19, yes, they should be quarantining for 14 days. But the other thing to make sure is that if you're living in the household, that you're not sharing any kind of utensils, drinking cups, towels, anything like that. You want to clean the bathroom between uses. You want to wear your mask indoors. You want to be protective of everyone else in the household so they don't develop COVID-19.
Okay, so hopefully this answers the question. So that person does need to be mindful that they need to quarantine. All right, so thank you, and please come back with us next week. We want you to complete the 1-minute evaluation that will pop up immediately following this webinar today, and it will come to you shortly. So please fill it out. The information you share with us helps us to plan for future webinars. And we are going to ask you to join us next week. I did ask you if you were interested in joining us and be available to join us next week, please do so. We have gotten some responses on that. So we will be back here next Friday, the 27th, with more information and updates for you. And we want to just encourage you, flip back over now to the Healthy Flint Research Coordinating Center's research seminar, which will be immediately following this. So we're going to thank you all for joining us today. And again, let me say, let's stay safe, keep ourselves safe and our families safe, and we will see you again next week. Have a wonderful, wonderful weekend.